Hi, my name's Nikki Becker, and I'm the Program Coordinator for Summit County Public Health's Senior and Adult Services Department. Our department is dedicated to advancing health equity for older adults through wellness initiatives, prevention services, safety efforts, and improved access to care across our service area. We serve older adults and their caregivers who are in need of support due to known or suspected dementia or Alzheimer's disease, chronic disease, or an intellectual and developmental disability. I want to talk to you today about our BRI Care Consultation program. It's an evidence based caregiver support program that was developed by the Benjamin Rose Institute on Aging, which just happens to be in our backyard up in Cleveland. The program provides personalized, ongoing assistance to caregivers through phone and email based coaching and resource coordination, meeting them right where they are, which is probably overwhelmed with not enough hours in the day. Our staff of care consultants have taken the guesswork out of where to look. Caregivers are often tasked with finding resources they have never utilized before, sometimes in locations they are unfamiliar with. And let's just be honest, you don't know what you don't know until you suddenly need to know it. Our staff is comprised of social workers and counselors trained to connect individuals to needed health and community services. Once enrolled in the program, a care consultant will listen to what you or your loved one's needs are and then help create a step by step plan of action that will help you navigate your individual situation. There are no cookie cutter plans. We know that as disease progresses, the care and strategies used to manage difficult situations and behaviors may need to be revisited, reassessed, and a new plan may need to be created. Our staff is ready to help you make the needed pivot if or when that time comes. After the initial assessment and plan has been discussed, care consultants continue to provide support through ongoing phone calls or emails based on need. Initially, a care consultant may be in contact with a client once a week, especially if they're helping with certain referrals or paperwork, but that schedule may change to check ins every couple of weeks if things are going well. We have an open communication policy so that we can best assess our clients, help them to build additional supports around them, make adjustments as changes happen, or to just provide the needed emotional support when up against a challenge. Our care consultants are here. They're here for you. I mentioned at the start that this program is evidence based. We know that people who participate in the BRI Care Consultation program have less stress and feelings of depression or anxiety based on the support they receive. We know that those they are caring for have fewer unmet needs due to the connection of community resources. And we know that there are fewer visits to the ER and hospital when a caregiver feels less overwhelmed and supported because they and their loved ones have what they need in place. Ohio is an aging state. By 2030, the majority of the population will be 60 and older. Adult children who care for aging parents or other family members isn't a new concept, but what we are seeing is the growing trend of those caregiving adult children trying to raise their own young family or managing their career at the same time, burning the candle from both ends. Caregiver burnout is a real thing, and we can help to alleviate that. The BRI Care Consultation Program may just be the added resource they need in order to feel supported, seen, and encouraged as they navigate the ups and downs of caregiving. Oh, I almost forgot. The best part, there's no cost to participate in this program. All services that we provide are free thanks to grant funding. So there's no reason not to give us a call or make a referral to see if we might be the right program for your or their situation. Okay, so you know what the program is, you know what care consultants do. You even know that the program has no cost associated to it. So what's next? Either making a referral for someone or enrolling yourself in the program. You can do that by either calling 330-926-5650, or you can send an email to our secure email address. It's listed on the page. We ask that you provide the name, address, and phone number of the caregiver, age of the person being cared for, initial concern or area of need, and if you are making a referral for someone else, your name, contact information, and agency name if appropriate. We do not have an income requirement in order to participate. We also have the ability to be flexible with the age of the person being cared for, depending on the diagnosis. For example, we know that someone who has early onset dementia can be as young as in their 40s. We've recently even expanded our service area outside of Summit County to include Portage, Stark, and Wayne counties. So if the caregiver or the person being cared for is within those 4 counties, they're eligible for our BRI Care Consultation program. I hope that you've enjoyed learning a bit about our BRI Care Consultation program. If you would like additional information or would like to learn about any of our other programs, feel free to visit us on our website or reach out via phone or email. Thank you, and we look forward to hearing from you soon. Bye.